Dr. Jaffe, if someone tests positive or has a hypersensitivity to titanium dioxide on the LRA by Lysac testing, can that hypersensitivity be related or can that cause hypersensitivity to titanium implanted devices and dental materials as well?
Boy, that's a very important and very timely question. I can tell you the researchers who look at why implants succeed and why implants fail are increasingly seeing that when the immune system is overly active because of digestive problems, because of maldigestion, dysbiosis, and all the consequences thereof, that one, and maybe a primary cause of titanium implant failure is hypersensitivity to titanium dioxide. Now, you may think of titanium dioxide as white, the whitener in white paint, but it's also the whitener in the coating of many medicines. It's included in the encapsulation of some medicines. And the reason that we test for hypersensitivity is if you have hypersensitivity to titanium, you should not have a titanium implant. And in fact, you should have Clifford method hypersensitivity testing or reactivity testing, and that will confirm the issues of what your body is compatible with and what your body reacts against. And so the area of implants is still evolving. Many colleagues have entirely given up on metallic implants of any kind, titanium or others, and gone to ceramics, which have their own set of issues. For another day, we can discuss that. So be aware that there are many places where you could get titanium in processed foods, in medications, probably not from paint, unless you're chewing on the mantelpiece or something. So titanium sensitivity may well be related, although we don't have enough studies to be definitive about this, but it may well be related. And screening for hypersensitivity to implant materials is something we urge, both through the LRA testing as well as through the Clifford method testing, so that you can use the safer materials for each individual.
So if somebody has got the titanium implant in already and they test positive on the for titanium on the LRA testing, would you suggest they work on removing that or detoxification? What would be the first thing to do?
I was afraid you were going to ask me that question because that is the logical question to ask. And the answer is, in a better world, you would remove from exposure everything that reacts on the LRA test, plus some other things that are just generally bad for you. Now, let me get more personal and specific. Someone has one or more titanium implants. However, they are not experiencing either swelling or pain, repair deficit inflammation, signs on a digital x-ray that there's erosion of bone next to the titanium. Any of those would be reasons from my point of view to urge people to remove the titanium implant. And what would you go to? I would suggest you go to a nylon appliance. Nylon is a very inert but very remarkable material. There's no implant. You actually take these out and wash them with water and put them back in the morning. So I have chosen myself, given the option of an implant versus an appliance, to go with nylon appliances. If I had an implant, I would take it out if I had LRA sensitivity. I personally would not even wait for the signs and symptoms of leaching from the titanium implant because 100% of titanium implants leach. So there's not a question about whether the titanium implant leaches titanium into the body. It is a question for each individual what their threshold is, what their repair mechanisms are like, what their hormonal responses are, their stress level, and so forth and so on, that all influence the answer to the question. So in a better world, we would avoid anything to which we're hypersensitive, including implants. If I removed an implant, I would not immediately replace it with ceramic. I would not. But I would consider a nylon appliance. These are relatively recent. They've been available, I believe, for about 6 or 7 years. I've had mine for about 3. I am very pleased with the results, and I'm very pleased that my dentist knew enough to say, do you know what nylon is? Now, I happen to be a biochemist, and nylon is made from 2 amino acids, one of which is called lysine, that's a very important amino acid, and the other of which is called adipic acid, which is actually derived from lysine. So it brings me back to my doctoral dissertation days, that when I studied D-penicillamine and connective tissue crosslinks and the impact of all of that on all of this. So it's an area of great interest to me. And while we're waiting for larger, longer term studies, the biological dentists that I rely on would remove any implant that had hypersensitivity associated with its components and would consider replacing it with a nylon appliance.